Medicare is a federal health insurance program. It was created for people that are 65 and older. It was signed into law in 1965. But over the years, the coverage options and the folks that are eligible for Medicare has changed. Medicare is made up of several primary components or parts. So I'm just going to go over different aspects of it. The folks that are eligible, there's 4 basic groups. People who are 65 and older, people who are under 65 that have certain disabilities and they're deemed disabled through the Social Security Administration, and anyone with end-stage renal disease at any age, and if they're disabled due to ALS. So that's the 4 primary groups. So we see a range of people from 18 to 90, and we can help all of those folks. There's the basic coverage of original Medicare is your Part A, which is your hospitalization. It covers hospital services and emergency care. There's usually not a premium for your Part A if you've worked 40 quarters, which equals about 10 years, and you've paid into your Social Security, then you usually do not have a premium for your Part A. Part B is your medical. It covers doctor's office visits, and there is a premium for your Part B. For anyone that's new, in 2016, it's $121. If you were previously enrolled, it stayed at the $104 because there was no cost of living increase. Now, next year that may change. Sometimes it changes every year. Sometimes it's a couple of years before it changes, but it does have a premium. Part A covers your hospital stays, skilled nursing facility care, home health care services, hospice care, blood, and there is a deductible of $1,288 for inpatient hospital stays. And if you go to the hospital, sometimes you can be there for up to 72 hours and you're under observation, so that deductible would not apply to that. You have to make sure that you know for a fact if you're inpatient, because it makes a difference in how you are billed for your services. Because if you're not inpatient, then your Part B would be what would be billed for that. And Medicare is 80-20. They pay 80%. You're responsible for 20% after you meet your deductibles. Part B covers your doctor's services, medical and other services, tests other than lab tests, clinical laboratory services, preventive services, home health services, mental health services, outpatient therapy, and Part B has a $166 deductible, and it's also 80-20 after you've met that deductible for any Medicare approved charges. So the things that are not covered by Part A or B are long-term care. So if you have to go into a nursing facility indefinitely, they do not pay for that. Routine dental care, dentures, cosmetic surgery, acupuncture, hearing aids, and exams for fitting hearing aids. There are some special instances where they will pay for some vision services. For instance, if you have cataract services, they'll pay for like eyeglasses after that. But I think whenever it was enacted, they didn't expect people to live past 65. That's why they made it 65 as the eligibility. So I assume they didn't think you should be able to eat, see, or hear once you got past a certain age. So Medicare is not all inclusive. So, and a lot of people don't realize that, but there are some things that they do not pay for. So and prescription drug plans, prescriptions is not covered under original. So these are some ways to enhance your coverage. Medicare Part D, and that's what covers your prescriptions. That's the bulk of the folks we see here at the center. This is the coordinating site. We help a lot of people do comparisons and get enrolled in prescription drug plans, especially during open enrollment, October 15th through December 7th every year. So we help a lot of folks with that. Then you can also have an Advantage plan. Some people call that Medicare C. Advantage plans is easier for folks to understand because they have television commercials. Everybody gets a lot of advertising in the mail, but these are like all-inclusive plans. They cover your hospital, your doctors, and your prescriptions, kind of like employer group health plans for us folks that are still working and have insurance through our employers. These can also cover some limited dental, vision, and hearing.
Is that what they call a replacement plan too?
It does replace original Medicare, and some people get confused because they think that they can use their original Medicare card plus their Advantage plan card together, and it's kind of a supplement, and you can't do that. It takes the place of original Medicare. And then we have folks that throw their Medicare cards away because they're like, well, I have this Advantage plan, I don't need this anymore. And then, you know, they do need it, especially if they want to do any kind of comparison, because you need that card. So we just try to stress to people, do not throw your Medicare card away. But yeah, you can't use them together. And Medicare Part D, like I said, it covers drug plans. It's sold by private insurance companies. And we don't sell insurance. We give unbiased information so people can make informed decisions. You know, some people have come back and said, well, that plan you sold me, and it's like, no, we don't sell insurance. We give you information and we let you make the choice of what it is that you want to be enrolled in. And everybody that's new to Medicare has a 7-month window of time to get enrolled in a prescription drug plan without getting a penalty. And the penalty is usually 1% of the base rate for a standard drug plan. Right now it's 31 cents for each month you're late getting signed up. I know it doesn't sound like a lot, but we've had people that's gone 5 years without a drug plan, and then they decide to get enrolled in a drug plan and they're penalized 31 cents for each month they were late getting signed up, and they add that on to your drug plan premium, and you pay that penalty for the rest of the time that you're enrolled in a Part D plan. So it's very important for people to enroll in stuff when it's within their initial enrollment period. So if you're new to Medicare, you have like the 3 months before your effective date, and then the 3 months after your effective date, and of course the date that you become effective, because that's different for some folks. If you're 65, it's usually based on your birthday, but if you're disabled, you know, you can become eligible at any time. It's usually a 24-month wait for folks that's under 65. If you're classified as disabled, you have to be declared disabled for 24 months before you're eligible to receive Medicare. And the month that you enroll affects the effective date of your prescription drug plan. So if you were to enroll in August, your plan wouldn't be effective until September. Even if you enrolled August 1, it still wouldn't be effective until September the 1st. They may not have their card by then, but their plan should be effective. And if you are entitled to special enrollment period, some people lose coverage for one reason or another. You could move out of move from one state to another. You can move from one county to another. You could lose your employer group health plan and that prescription drug coverage. So for special enrollment periods, it just depends on when you lose it, but you usually have 63 days after you lose coverage based on any of those existing things that I spoke of to get enrolled in a prescription drug plan without being penalized. So if you were working and you were going to retire in June, you would have like 63 days after your official retirement date to get enrolled in a prescription drug plan without incurring a penalty. So, and if you don't enroll during that time frame, then you have to wait until open enrollment comes around, which is October 15th or December 7th every year. And that's when anybody can make changes to their prescription drug plans. And we suggest that they do so because those plans change every year. The drug list change, the premiums change, the tier structure of some drugs change. So we suggest that people do that, and that's what we're here mostly to help people with. The premiums range from $18 to like over $100 for these drug plans, and it's hard to tell some folks, well, this plan might not work for you because their neighbor has a plan and that's what they want because it works for their neighbor, but they may not be taking the same medications. That's why we do the comparisons. But there is a program through the Social Security Administration called the Low Income Subsidy, where folks can qualify for extra help to pay for their medications. A person can qualify for low income subsidy and not the Medicare Savings Program. But what that does, it pays up to $31 for a drug plan if you get full extra help. and then it lowers your co-pays for your medications if they're covered. If it's a generic, you're only going to pay $2.95 or less, and if it's a name brand, you're only going to pay $7.40 or less. So if we have a person that's taking a drug that's over $200 at full cost and they can get it for $7, that's saving that person a lot of money. So we suggest that if you know anybody that meets these income and asset qualifications, to have them contact us, and we can do those applications for them as well. It's quicker for us to do it, or if they are computer savvy, they can do it themselves, because you can go to the Social Security Administration's website and you can fill that application out online. It's quicker than filling out the paper application, because some folks, when they become new to Medicare, Social Security will send them a paper application to fill out, and it's kind of hard to fill out and get it done right. So it's easier to do that application online and get it sent in that way, and you get a quicker response. The Medicare savings programs, that's through DSS. The income amounts are not as high as the low income subsidy, so fewer people qualify for that. But what that does, if you qualify for MQB, it can pay your Part B premium. That $121, they will put that back into that person's check. So that helps people out a lot. And then some people get their co-pays and deductibles paid as well for Part A and Part B if they are at a really, really low income. And then some people even end up qualifying for full Medicaid. And that's the best of both worlds, full Medicaid and Medicare. So, and a prescription drug plan, and you're pretty much set. So we just try to get the word out about these two programs, so people are taking advantage of that. So Advantage plans, and you already spoke to that, being a replacement plan. And the advantage to those plans are that they have no deductibles. There's a couple of newer plans that do have like a $500 deductible now, but it's nowhere near the $1,288. But you know for a fact how much you're going to pay when you go to your doctor, how much you're going to pay when you go to a specialist. The drawback with the Advantage plans, they are based on your zip code. The two types of plans we have here in McDowell County are HMOs, which means you have to stay within that network. And then we have a PPO, which is a preferred provider. They prefer that you see certain folks, but you can go outside of your network if a person takes it, but you're going to pay more money if you go outside of the network. So that's one of the drawbacks, because especially if you have multiple providers, you need to check with all of those folks before you decide to go with an Advantage plan, because your primary doctor may accept that plan, but the specialist he sends you to may not, and then you end up paying full price for your services. You have to research those plans thoroughly before you enroll in them, because once you're in them, unless you're receiving extra help, you can't get out until open enrollment comes back around, and then you're stuck with something you can't use because you didn't research. Okay, Medigap is what we call supplemental plans, and a lot of people get Medigap and prescription drug plans confused because they think their prescription drug plan is a supplement. The Medigap plans are designed to pick up what your Part A and B does not cover. The F plan is usually the most popular because it picks up everything. It picks up the Part A deductible, it picks up the Part B deductible, it picks up the co-pays, but there are additional premiums for these plans. Some people can afford to do it and some can't. You can't have a supplemental plan and an Advantage plan at the same time. You can only use the supplemental plans with original Medicare.
How much does the F usually cost?
It varies. It ranges anywhere from like $120 up to like $400, and all the plans have to cover the same thing. But every F plan, no matter if it's a Blue Cross Blue Shield plan, a Humana, or some off brand that somebody has never heard of, they all have to cover these same basic things. So the F plan and the G plan, they're pretty much neck and neck. The G plan just doesn't cover the Part B deductible, but that's only $166. So either one of those, if you can afford to do it in conjunction with your original Medicare, it helps folks out to where they don't really have a lot of out-of-pocket costs. And those supplemental plans are standardized and they have to be approved by Medicare. And like I said, they are designed to pick up the gaps, and that's why they're called Medigap, because again, Medicare is only 80/20, so it kind of picks up what Medicare does not cover. And they're sold by private companies. Because we don't sell insurance, we can do a comparison, show you the list of companies that's available, give you more information on those companies. And it's better to have that information because you're going to have to contact them yourself, and it's better than flying blind. You know, at least you have something in front of you that can say, well, you know, I did a comparison with my SHIIP representative, and this is what it shows that this plan would cost me. And at least they know that you researched it, and they don't try to sell you something else that you really don't need. So there's not like a penalty for these plans. You don't have to take these. There's not a time frame of enrollment, but there's a guaranteed issuance time frame, and that is where you are allowed to enroll in one of these plans without them basing it on your age, pre-existing conditions, or anything like that. And that's 3 months before you turn 65 and the 3 months after you become 65. So some people decide to get signed up later, and they have the right to do that, but the companies may do underwriting based on how many claims they've had with Medicare and what their health issues are, and it may cost more than it would have if you would have gotten enrolled during the time frame of that 3 months before your 65th birthday and the 3 months after. But they're expensive. The premiums change often, but you know, some people can afford to do that, and that's why we try to give people information based on where they are, you know, what your finances are, what medications you're taking. And supplemental plans, these Medigap plans, do not pay anything towards prescription drug plans. It's just towards your Part A and Part B. Then your other ways to supplement your Medicare is some people are fortunate enough to keep their employer group insurance, and then you can have Medicare with your employer group. You just have to make sure you talk to your HR folks to see whether your employer group plan is going to be primary or secondary to Medicare, because sometimes you can delay taking your Part B. You should always take your Part A when it's offered because it's free. But Part B, there is a premium for it. And some people that work past 65, they will delay taking their Part B if their employer group health plan is able to be their primary. So, but once you lose that coverage, you still have that same like 63-day. I don't know why it's 63 days. I guess they give you an extra 3 days to think about it. But that time frame to, you know, get enrolled in Part B and everything like that. And military retiree coverage, TRICARE for life. Some veterans are under the assumption that because they are veterans, they can go to the VA and have all of their services provided, and it doesn't work that way. You still have to take your Medicare and still get the VA benefits. Now, the veterans are the only group of folks that can have 2 prescription drug plans at the same time. Everybody else can't. You can only have one. Because, you know, sometimes they may not be able to get to the VA to fill their medications, or they may get an antibiotic and can just pick it up at a local pharmacy. So they can have a prescription drug plan to do that. And then they're not assessed a late penalty if they decide to get into a prescription plan after their initial coverage period. So, but some people, they won't take their Medicare Part B when it's offered. There's a 10% penalty if you're eligible for Medicare and you don't take it when it's offered. We had a gentleman that works here, and he didn't take it because he was with the VA, and then he needed like a knee surgery, but he couldn't have it done because he didn't have the Part B, because it was going to be like outpatient. So he finally got enrolled, and they charged the 10% for each year that he was not enrolled, and they add that on to like the $121. So it's good to do stuff when it's within your time frame, because they do assess penalties, and that the penalty for the Part B, you can't get out of that. You can the penalties for Part D if you income qualify for extra help, but the penalties for the Part B, if you sign up late for that, then they're going to be there regardless of if you receive extra help or not.
And you have to pay that 10% every month do you have to pay that 10%
Yeah, it's on there for the duration that you have Medicare. So if it's $121 and you went 5 years, they're gonna add 50% to that $121, and that's how much you're gonna pay for Medicare every month. Yeah. So, and if you don't enroll in Medicare when you first turn 65, the open enrollment for that is January 1st through March 31st, and then it's not effective until July. So, a lot of people don't realize that. They think, well, I didn't take it then, and I'll get enrolled next month. No, there's an open enrollment period for that as well, and like I said, it's January 1st through March 31st. There's so many different enrollment periods, they just run together. So
if someone is penalized and can't afford the monthly premium, then what happens?
I'm not sure, because I don't think the MQB is more than the standard Part B, but I would have to check with somebody at DSS for that. Because like I said, if you qualify for MQB, and that's the Medicaid that pays for your Part B premium, they will pay that premium, but I don't know about the penalty part. And that brings us to Medicaid, because MQB is a Medicaid or Medicare Savings Program. The folks at DSS fills out those applications. We can do a low income subsidy application, and then there's a section in that application that asks if you want them to send your information on to DSS to see if you qualify. It's quicker for a person to fill out that application themselves at DSS, because if they send it from Social Security, it takes months and months and months for it to get on the desk of a caseworker. So if they call DSS or go by DSS and get those applications done, they can get an answer in a couple of days versus a couple of months. And it makes a big difference, because some folks end up qualifying for full Medicaid. Some folks end up qualifying for food and nutrition benefits. So, if somebody thinks that they qualify for that, then now full Medicaid, I'm not really sure what the income limits are for that. I know it's really low, and then there are certain things that they count that the Social Security doesn't count for the low income subsidy. So, because the low income subsidy, they don't count like insurance policies, they don't count your house that you live in, and they don't count your vehicle. I'm not really sure what things DSS counts towards the Medicaid. But those savings programs, they're a big help to a lot of people. We save people a lot of money by referring them to DSS to get that done. So if you think you know anybody that may qualify for any of these programs, just get them in touch with us, and we can either do the applications for them or get them linked up with somebody at DSS. So what are the costs? Again, like I said, there is a premium. Nothing is free. Some people take Advantage plans because they think they are free, because that's how they are marketed on television. They're not free because they are like replacement plans. The $121 that they take out of your Social Security check for your Part B, if you decide to go with an Advantage plan, that $121 goes to that plan. So it's not free. They're just not charging you anything extra. If that plan costs $50, they're getting the $121 plus the $50, so that plan really costs $171. And we get a lot of people that's confused by that. Well, I want that free plan. Where there's no free plan. No free plans. There's assistance to help pay for premiums, but there's no free plans. You could end up getting your prescription drug plan for free if it doesn't cost more than $31, but somebody else is paying for that. It's not coming out of your pocket, but somebody else is still paying for that. And then just ways to get help. If you want any information, you can of course call us here at the center. We are the coordinating site, and then there's a Raleigh number, and all of that information about the North Carolina SHIIP is in this SHIIP combo form. But they have the same folks, they do the same thing that we do. Most of the time they're going to tell you to find your coordinating site anyway. If you call them, and they'll say, hey, you need to call Dawna. So they usually refer you to your local site because they're in Raleigh. And some people, one-on-one counseling is better than talking to people over the phone, because some people can't understand well over the phone, and some people are visual people and they need to see stuff for themselves. So but we can do counselings over the phone. I have done stuff through email for folks, and then we have the one-on-one. We see folks by appointment only. Myself and Waylon Prebor, he's the other counselor. We do the majority of the enrollments, and then we have a person at Old Fort, and then we have other people in the community that do other things like outreach and different things of that nature. So Medicare is 24 hours, 7 days a week information. It's hard to get a live person on the phone for Medicare, and you can set up a My Medicare account to where you can go on their website and look at stuff that's specific to you. And if you lose your Medicare card, you can get a replacement card, and you can do all of that stuff on their website. The Social Security Administration, any questions in regards to like your check or the low income subsidy, those are folks that you would need to contact for that, to request replacement Medicare cards as well. Employer benefits reps, especially if you're still working, if you're going to keep your employer group, just like with you in the state health plan, it's good to have a relationship with those folks so you can stay on top of whatever changes they have going on, because they know more about their plans and their benefits than we do. And then of course your local DSS, they can help with the MQB, the Medicare savings programs, and then like I said, some folks qualify for full Medicaid, which is awesome. I love it when a person is dual eligible, because they're saving lots and lots of money. And then TRICARE for Life, we have a veteran service rep here, Doug Googe, so any questions about VA benefits, he would be able to answer those questions. So that's the end of my slide presentation. So this is Medicare.gov. This is a really good website, because you can go on here and sign up or change plans. It's got different information on how to apply for Medicare online, how to get drug coverage. There's an overview on what it costs for Medicare A and B, and ways to pay for your Part A and B. There's information on what Medicare covers, preventive and screening services. That's a big deal too. A lot of those are free that people don't take advantage of. Colorectal screenings, breast cancer screenings, diabetes screenings, flu shots, immunizations, those things are free. Glaucoma screening. I've done a lot of talking today. But there's a whole list of all the different things that's covered and at what intervals. So we try to push that. We want our folks to be healthy and to take advantage of those screenings. So that information is good information as well. There's also a section for filing complaints. Medicare fraud is huge, and we have to remind folks all the time. Nobody from Medicare will call you at your home to ask for your information. Never give out your information to anybody that you're not sure of. And we have some insurance agents that will call people or just show up at people's houses, and they're not allowed to do that. So we try to make people aware of that, because some insurance agents are okay, and then some are just out for the money, and we get people that's enrolled in stuff they can't use all the time because they've let somebody come to their house to sign them up for stuff, and then they're stuck in it until the next year rolls around with stuff they can't even use. So they're going without services, going without medications, because they've got the wrong information and got enrolled in something that they can't use. So this finding health and drug plans, this is usually where we go to do comparisons. And I'm going to show you a quick general search of how we look at drug plans, because I don't want to use anybody's personal information. And it's usually based on your zip code. And I'm going to use just the regular 28752. And then it gives you the option to choose which county, because we border on Rutherford and Burke. So it pops up as either one sometimes. And I'm going to say this person has original Medicare, and that they do not get any extra help. That means they don't get any assistance paying for anything. So when this comes up, if this had been a personalized search, and say this person was enrolled in the Humana Walmart plan, it would show here that their current coverage was Humana Walmart, but they're not, so it just says original Medicare, and it shows that they have no extra help. And then you can add the drugs they take, and if somebody just wants to shout out a medication, and I'll add a few.
Crestor.
And I'll just use the standard dose, and you see how many different options we have. And that's why it's important to fill out that tool finder. And I'm just going to say they refill it every month. And then it's going to ask me if I want to use the generic or the name brand. You want me to keep the name brand or use the generic?
Well, I'm using the generic now, but it's still expensive.
Yeah. So we'll use the generic.
Okay.
And then once you put at least one drug in, it'll give you a drug list and a password date. If this had been associated to a person on the personalized search, whenever we put that person's Medicare information in, it would bring up this same drug list, and then we could alter it how we need it to. So that makes it more convenient. So somebody give me another drug.
Lisinopril.
Which one you want?
First one's fine.
I'm trying to think of something that's name brand. I'm a Humalog. And let's see.
Coumadin.
And you can change the dosages if you need to. I'm just going to change the quantities. I don't know if anybody would take 2 of these a day, but I'm just going to change the quantities just to show you that you can change those. And then it's going to ask if I want to use the generic. I'm going to leave it at the brand because I'm pretty sure that none of the plans are going to pay for that as a brand drug. They probably want you to use the generic, so I'll leave that just to mix it up a little bit. So I think that's a good list. And then it wants to know your preferred pharmacy, and this does make a difference because the drugs could be cheaper at Walmart than they are at CVS. Some drug plans prefer certain drug stores than others, so we'll use good old Walmart. And which other one would you guys want to use?
The hospital.
Where is it? Here? Okay. Okay, so whenever you put your drug plans, your drugs in, you have 3 different options. You can look for standalone plans, and this is just prescription drug plans by themselves. You can look at Advantage plans, and this is the Advantage plans with drug coverage, and then they have 2 Advantage plans that do not have drug coverage. The only reason I could see somebody taking one of these is if they had like an employer health group plan that had prescription coverage, because you can't get one of these plans and then go back and get a prescription drug plan to go with it. So it really doesn't make much sense to me to have this, because then you don't have prescription drug coverage. Unless you're like the VA and you can get your drugs there, this might be an option for you if you're going to be doing something with doctors locally. But I'm going to click prescription drug plans and these Advantage plans, and we'll look at the drug plans by themselves first, and then we'll look at the prescription drug plans with the Advantage plan. And what it does is bring up the plans that you're going to spend the least amount of money on, and that covers the majority of your drugs. And it's different for everybody because everybody's drugs are different. And if you had a current prescription drug plan, it would show it here, but you don't, so it's just showing original Medicare. So, oh goodness. Well, this one covers all the drugs, so it pays for a Coumadin. But you see how much this premium is? $83. That one does, and this one doesn't. So we'll look at these because these are the ones that you're going to spend the least amount of money on. And you can kind of see the difference. And this is based on if you were to enroll today, how much you would spend for the rest of the year. And this amount includes your premium and the copay for your medicines. If I go further down, it gets more expensive. So we can only compare 3 at one time, so we compared the top 3. Okay, so it'll give you the name of the plans, their members, IDs, and all of that stuff, the phone numbers. But this is what we try to show folks, the fixed cost, and then all of them have a deductible. You have to meet those deductibles before they pay anything towards the medications. Now, some plans, if it's generics, you don't have to meet the deductible first. They'll go ahead and pay some towards them, but, you know, most of the time you have a deductible. So, you see the difference in if you use Walmart versus the McDowell Hospital Pharmacy. Yeah, so it makes a difference which pharmacy you use. So, it's a big difference in whether you use Walmart. And this is based on enrollment today, and this is what they're estimating you to spend for the rest of the year if you refilled all of those medications on a monthly basis. And this kind of breaks it down for you, like what you would pay each month. With this plan here, you're going to meet your deductible the first month, and then it's going to go down the donut hole or the gap. And some people fall into it and some don't. The donut hole right now, if you and your plan have spent out $3,310, then that's when your donut hole phase begins, okay? And you stay within that donut hole until you reach the catastrophic. Now, the catastrophic phase is after you, by yourself, not in conjunction with the plan, after you have spent $4,850 on your medications, then you fall into the catastrophic. And once you reach that stage, then the cost of your medicine goes down, and you're not going to reach it on here. But
is that an additional $4,850? So like $8,000 in total?
no, it's between that threshold.
Between $3,300 and $4,800.
Yeah. So, and as you see, when you reach the donut hole, the price of your medicines go up. So, a lot of people try to avoid that. There are some patient assistance programs that will pay for some medications when you fall into the donut hole, but, you know, you have to research those. And we can look. I usually use Needy Meds. I think you told me a different program to look at patients assistance programs.
Does NC Med-Assist do
NC
that?
Med-Assist, okay.
So all of the drug programs, all of the, these have a donut hole. Like if you buy a prescription program, they all have donut holes.
The donut hole
is you buy.
No matter which one, but some people fall into it and some don't. It just depends on what medications you're taking and how much your medications cost. Everybody's not going to fall into the donut hole. Now, if you qualify for extra help to pay for your medicines, you won't fall into the you're not going to fall into the donut hole. But it just depends on what you're taking.
Do you know the logic behind why there's a donut hole?
No, I don't. I guess they don't want to spend so much. And with when the Affordable Care Act was enacted, I think by 2020 it's supposed to close the donut hole altogether. So it's slowly closing it up, but it's really not quick enough. I don't know what. I have no clue what the option. I have no clue. and see that's at and this is based on Walmart, and that's their preferred pharmacy. Now, if we click on this and go to the McDowell Hospital, yeah, because it's like they're not paying anything. You pay 100% of the cost for these drugs at this pharmacy because it's not the plan's retail network.
So is that inflation from the hospital, or is that because they're not in the network?
It's because they're not in the network, and then it says please check with the plan for long-term care, because I'm thinking they're thinking this is a person that's like in a long-term care facility.
Gotcha.
It's an out-of-network pharmacy, so that's why you're paying like full price for your medicines until you fall into the gap. And then And then you have the mail order option if you wanted to do that. So on this plan, mail order is cheaper. It's not cheaper than Walmart, but it's cheaper. So it just varies. And all plans don't cover all drugs, and that's why we do comparisons. Any questions about comparisons?